Let's discuss today the another topic of the fertility or the hormones checkup, and that is the progesterone. Now let's discuss what is progesterone. Progesterone is a hormone that occurs naturally in the body. It's involved in the pregnancy and it is produced mainly in the ovaries. It can also be made in the lab. Progesterone level can affect menstrual period and the menopause symptoms. All the progesterone's products are made in a lab. The term natural progesterone refers to progesterone made from a chemical called diosgenin, which comes from wild yum or soy. The human body is not able to make the progesterone from the diosgenin. So, eating wild yum or soy will not boost progesterone levels as well as. Now, why do I need this progesterone test? So, here we go one by one. You may need this progesterone test if you are having trouble getting pregnant. A progesterone test can help your healthcare provider see if your ovaries are releasing eggs normally or not. You are having fertility treatments or not. You are having abnormal bleeding when you are not pregnant or pregnant. You are pregnant and you are having progesterone therapy to prevent a miscarriage. Your doctor wants to check the health of your pregnancy because of you have a higher risk, not high risk for the miscarriage or the other pregnancy complications. You have signs of miscarriage or ectopic pregnancy such as cramps or bleeding, etc. Now let's discuss and understand why and what is used for. A progesterone test may be used to help find the cause of female infertility, check to see if fertility treatments are working or not, find out your risk of a miscarriage, diagnose an ectopic pregnancy, which is a fertilized egg that rise to grow outside of the uterus. The egg cannot grow into a baby when it's in the wrong place. It must be removed to avoid damage to your organs. This can be a medical emergency. Okay. Check the health of a high risk pregnancy. Diagnose ovaries cancer or problems with your adrenal glands. Normally your adrenal glands make small amounts of progesterone. Okay. High levels of progesterone may be a sign of an adrenal gland disorder in both males and in females as well as. Now let's know in this slide the prevention precautions for the progesterone test before the test and after the test as well as. So let's go. Pregnancy. Prescription progesterone products are likely safe when applied into the vagina as a part of infertility treatment or while pregnant to prevent preterm labor. But progesterone is likely unsafe when used during pregnancy for any other purpose. There isn't enough reliable information to know if non-prescription forms of progesterones are safe to use during pregnancy or not. So stay on the safe side and avoid use. The second, breastfeeding. There isn't enough. I have already told you this thing. There isn't enough reliable information to know if progesterone is safe to use when breastfeeding or not. So stay on the safe side and avoid the use. Breast cancer. Don't use non-prescription form, as I have already told, of progesterone if you have breast cancer or a history of breast cancer. Depression. Don't use non-prescription forms of progesterone if you have a depression. Liver disease. Progesterone might make liver disease worse. Don't use non-prescription forms of progesterone if you have any kind of liver disease. I tell you that if you have any kind of disease, first of all you need to consult your doctor first. Don't search on the Google, don't search on the YouTube. What are the prevention and the precautions taken before the test and after the test? Don't need precautions. Just ask your doctor. So vaginal bleeding, if you have a undiagnosed vaginal bleeding, don't use non-prescription forms of progesterone as well as. So what do the result mean of progesterone and what is the meaning? How do understand? So here we go. The meaning of your test result depend on why you had the test, where you were in your menstrual cycle when your blood sample was taken, high progesterone levels when you are not pregnant may be linked to a cyst on your ovaries cancer, adrenal gland problem including adrenal gland cancer even, or an inherited disorder called congenital adrenal hyperplasia. So higher than expected progesterone levels may mean if you are pregnant that you are having 2 or more babies. High progesterone level may also be a sign of molar pregnancy, which is an abnormal growth of tissues in the uterus. It's caused by a fertilized egg with such a severe genetic problems that it cannot become a baby. The growth can turn into a cancer and must be removed. Low progesterone level may mean when you are and why you are not pregnant, may be linked to not ovulating normally, not having a menstrual period. When you are pregnant, may be linked to ectopic pregnancy, miscarriage or high risk of miscarriage, etc. But your doctor will definitely explain you very clearly what the test result mean by you. So progesterone levels are measured in the nanograms per milliliter. The chart below, which I have given you, listed normal levels of progesterone for an adult female during different points of the menstrual cycle and pregnancy. So you can check out the very carefully the normal ranges by your male and female gender. Okay, so thank you very much for watching the video. But every lab technician or the every lab said their different kinds of parameter, different kinds of units on their lab report. So consult your lab technician from where you have given your sample and from where you have taken your report, and your doctor will definitely make you understand the exact meaning and exact the range what levels are suitable by your age, by your gender.